The healthcare system in a state of limbo as nurses across the country take action, while the government is taking measures to address any shortfalls. Cleopatra Murphy has details of the action that could have stemmed from a dispute over overtime.
Widespread industrial action could be having a crippling effect on the public healthcare system, as nurses from New Providence, Grand Bahama, and the Family Islands have called in sick. Although she could not confirm the numbers, Bahamas Nurses Union President Muriel Lightbourn confirmed she received reports of more nurses than usual calling in.
Can't really speak to whether it's a definite sick out or if the nurses are sick.
ZNS News received reports that some 140 nurses were out, with critical areas at PMH like ICU impacted. Either way, Lightbourn says it could be devastating.
We don't need one nurse out of an area, especially a critical area, is a big deficiency, and you don't want that to happen. So could you imagine if you have more than one nurse calling out? You have 6, 7 nurses in one department calling out. That's crippling, especially if it's going to be a critical area like accident and emergency, somewhere like that. We can't afford that.
The apparent industrial action comes as the PHA in a recent memo informed staff it had used up the money budgeted for overtime and that overtime would not be processed unless approved by Managing Director Aubinet Roll. The change taking effect in the January pay period. Lightbourn says it is her understanding officials were attempting to get supplementary financial support, but nurses feel deflated.
When you have people feeling disrespected, anything could happen. Anything could happen, and that is something that we need to improve, especially in our country.
All things considered, she says officials may find it hard getting someone else to fill in.
If people are understanding, believing that they're not going to be paid for the overtime, I don't know how you can call somebody else to ask them to come in.
The union president says the country cannot afford for nurses to be out sick, appealing for authorities to resolve the problem. Efforts to get a response from the PHA proved unsuccessful. When questioned about the situation at Thursday's weekly OPM press briefing, Press Secretary in the Office of the Prime Minister, Keishla Adderley, shared that the provision of health care is a priority for government, and when there are shortfalls, it is troubling.
An assessment is underway today to try and determine the extent of the problem and to make sure that coverage is in place where needed and that it's prioritized, as is the case in emergency situations and scenarios like these. In the meantime, we are very hopeful to speak with the relevant union stakeholders to get a handle on the problem, to speak about the situation and to come to a resolution so that the public health system can return to full strength.
For the Bahamas Tonight, I'm Cleopatra Murphy.